Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, April the 19th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, thank you, Brad, and good afternoon. More than 900,000 COVID-19 vaccine doses have now been administered in the City of Toronto alone. Toronto is the first local health region in Canada to deliver more than 900,000 vaccine doses. The City is working with its healthcare partners, pharmacies, and Toronto Public Health to administer all available COVID-19 vaccines with increasing efforts in COVID hotspots. To date, in actual fact, 907,070 COVID-19 vaccine doses have been administered in the City of Toronto. 29.2% of adults in the city have received at least their first dose. That's 1 in 3 adults already with a dose of vaccine. We have more work to do, but we are getting shots in the arms with efforts to step up in the days ahead. The Team Toronto effort is focused on getting as many residents vaccinated as quickly as possible based on available supply. And we are focused on getting the shots that we do have in the arms of residents in the hotspot neighbourhoods, the place where our public health officials say these vaccines are most needed and can make the biggest difference. People born in 1961 or earlier and aged 50 or older who live in hotspot neighbourhoods, as identified by postal code, can book vaccination appointments online or by phone at city-run COVID-19 vaccination clinics. And we continue to have pop-up and mobile clinics vaccinating residents 18 plus in postal code hotspots. For example, this past Saturday, a team comprised of community ambassadors, volunteers, clinical teams from across the city formed a pop-up clinic on the basketball courts at 15 Tobermory Drive and vaccinated 3,140 residents in the M3N postal code. This was an all-hands-on-deck effort. They made it an event. They publicized it locally at the grassroots level, and it worked. And that is why we're going to do this or some variation on this over and over and over again, in addition to our city-run clinics. The Tobermory team, if I can call it that, included, just to give you a sense of the range of who was involved in making this such a success. The Tobermory team included the Black Creek Community Health Centre, the Parkdale Queen West Community Health Centre, East Toronto Health Partners, Midwest Ontario Health Team, the Humber River Hospital, the Sinai Health System, the University Health Network, UHN, Women's College Hospital, and Global Medic. All of those people were involved in making sure we got those 3,000 people to the clinic and got them vaccinated. It's a real example of Team Toronto at work. Partners in a vaccination coalition combining forces to get shots in the arms of our hotspot neighbourhood residents. Clinics in Parkway Forest, led by the North York Toronto Health Partners, and in Crescent Town, led by the East Toronto Health Partners, also took place over the weekend with similar positive response and the same kind of fantastic teamwork. This has been done in part with the assistance of a partial reallocation of some of the vaccine supply from our city-operated clinics, and we continue to find ways, including that, to ramp up our combined team efforts. I was glad to see the province move Sunday to allow all residents 40 and older to register to get AstraZeneca from our pharmacies. I encourage anyone who is eligible to get the AstraZeneca shot. This is the same vaccine that I got over a week ago. I feel great, and most importantly, I know that I'm on my way to becoming fully immunized. So if you are eligible, please book your shot or get on your pharmacy's wait list. Our health officials have been clear that all of the vaccines are safe. Now is one of the most important moments, in fact, one of those very important moments during the pandemic when we all need to work together to confront this terrible virus, a virus that has been strengthened by the variants. We need people to do the right thing and to get vaccinated as soon as they have the opportunity. We need all of our vaccination partners working together to keep administering the vaccines and to be ready, which we are when we get additional supply, ready with the capacity to absorb and put to good use right away that additional supply when we get it. We need all governments working together The best way that we as leaders of governments can show that we truly understand the gravity of the situation, the tragedy that it is causing, and the tremendous anxiety and frustration it is causing among the people we all represent, the best way that we show we get it is by working together to defeat this virus. I met with the GTHA mayors and chairs again today to make sure that our local efforts in this region are coordinated. All of the GTHA mayors and chairs are thankful that Prime Minister Trudeau and Premier Ford are working together to help get more help in place in our region and to help combat the third wave of this pandemic. We stated clearly today that we welcome any additional health resources that can be deployed in the GTHA right now. And that includes the resources offered from other parts of the country, thanks to the Prime Minister's efforts, and the extra allocation of vaccines in the GTHA committed by the Premier. The situation is incredibly serious right now. It's incredibly serious. I know the vast majority of Toronto residents know that, and they want to do everything they can to save lives and to protect each other. I know that the case numbers are right now are scary. They're scary. They're like none other that we've seen throughout the whole year plus of this pandemic. I said earlier that I recognize the fact that people are frustrated, big time, extremely frustrated with this entire situation. But we will get through this. We can get through this. We must get through this. We can stop this virus. We will get everyone vaccinated. We're well on the way. Solid progress that we have made, with much more to be done, and with us ramping up our efforts to make sure that it gets done. We simply have to stick together. And that means supporting each other, that means government, and it means people sticking together and supporting each other. That's the only way in which we will get this done. It's now time for Dr. de Villa to offer her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 1,477 cases of COVID-19. Since last Thursday, we have reported 6,976 cases. There are 65 new hospitalizations to report, bringing the number of people in hospital to 881. 184 of them are in ICU. I'm sorry to report the loss of 6 more lives to COVID-19. Good news is in short supply these days, so I'm happy that, as you heard from the Mayor, mobile clinics over the weekend made a huge difference in the delivery of close to 5,500 vaccinations. Community leadership is an essential driver of those accomplishments over the weekend and going forward. Those community-driven clinics and community-driven awareness are vital to getting needles in arms and to addressing hesitancy. That's the extent of the good news, because the factors limiting it are many and threatening. To meet the threats, we need to do 4 key things. There is no question we need to acquire as much vaccine as we can get our hands on. But at this moment, most importantly, we need to double down on public health measures to disrupt transmission. We then need, as individuals, to do everything we can to act in ways that support results from those measures. And finally, while we manage what supply we have at present, we need to target carefully and wisely for maximum effect. Prioritizing vaccine delivery is the most efficient way to bring the spread under control in the places and populations where it is highest and most threatening. Last week, the chair of the province's Science Advisory Table said that it would take 59 vaccinations on a per capita basis to prevent 1 new case of COVID-19. A per capita basis is a broad-based approach to vaccine delivery. But 36 targeted vaccinations, vaccinations delivered in hotspots where infections are high, where risk of infection is high, and where there are concentrations of frontline and essential workers. just 36 targeted vaccines would prevent a new case of COVID-19. Mobile clinics and focus on hotspots reaches those targets and delivers that advantage. If we limit the spread there, we limit the spread everywhere. Doing that will make a difference to every person who lives in Toronto. The Premier is right when he says that we need more vaccines for Toronto, for the GTHA, for the province. We also need provisions to allow people to stay apart if they're ill. This includes paid sick days, even on a temporary emergency basis, so that people can afford to stay home if they're sick. The science supports this. As well, we need measures that will meaningfully limit transmission to make it harder for the virus to spread. This includes the capacity to swiftly and decisively act to make sure essential workplaces are safe places to work and aren't facilitating spread. There are significant ongoing discussions across the health sector to provide the province with advice on what more must be done to turn back this dangerous and surging level of transmission. The extent of the threat suggests the spread of the virus is not solved locally. I am amongst many peers who see the circumstances demanding a province-wide strategy. The variants have demonstrated that they are effective at being relentless. While they took a little longer to reach exponential growth than predicted, they have done exactly as expected. On February 8th, I said to you, today we are in a transition from one pandemic to another, a transition to a new pandemic. On February 17th, I said, I have never been as worried about the future as I am today. It's obvious now we are well into the worst part of the pandemic so far, and there are steps yet to take to get through it, to get past it, and put it behind us. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa. Good afternoon. Since April 12th, all of our 9 city-operated COVID-19 vaccine clinics have been operating daily, with appointments available between 11 a.m. and 8 p.m. 7 days per week. All 9 clinics continue to operate efficiently and smoothly, with each clinic operating either at or very near maximum capacity on a daily basis, based on vaccine availability. Wait times for those who arrive shortly before their scheduled appointment are very short, with most people not having to wait at all. In fact, the majority of people are checked in, vaccinated, and checked out of the clinic in about 30 minutes. The number of appointments that are made available in city-operated vaccine clinics corresponds directly with the number of doses of vaccine that are available to be administered. At present, we are able to administer 56,322 doses of vaccine each week across the network of city-operated clinics. We intentionally scale our clinic operations in order to protect vaccine allotment for our hospital and Ontario Health Team partners as well, such that their clinic operations are able to continue to the largest extent possible. Our immunization task force continues to be focused on vaccinating as many people as possible, as quickly as possible. This is a goal supported by our Team Toronto partners, including the City of Toronto, Ontario Health Teams, hospitals, pharmacies, and primary care physicians, all of whom are working in collaboration to maximize vaccine rollout across Toronto, including supporting mobile clinics as part of Phase 2. In direct collaboration with Dr. de Villa and our Immunization Task Force Command Team, we are hard at work identifying opportunities to further optimize the allocation and rollout of vaccine across Toronto. This includes looking at a number of options to prioritize the administration of COVID-19 vaccine in hotspot neighborhoods. By optimizing both our city-operated vaccine clinic operations, while also maximizing the supports we are able to provide to our hospital and Ontario Health Team partners for community-based mobile and pop-up clinics, we can ensure the most effective administration of vaccine in our city. As additional vaccine becomes available, we look forward to being able to significantly expand operations in our vaccine clinics, as well as in both mobile and pop-up clinic operations. Further information as to current opportunities to receive COVID-19 vaccine can be obtained at toronto.ca/COVID-19, as well as through our Team Toronto Hospital and Ontario Health Team partner website at vaccineto.ca. Eligible residents can book their vaccine appointment in city-operated clinics by accessing the online provincial booking system at toronto.ca/COVID-19 or via the provincial call centre at 1-888-999-6488. On April 15th, the Province of Ontario issued amended regulations resulting in the implementation of further COVID-19 restrictions. Since the announcement of these changes on Friday afternoon, our staff have been working around the clock to assess and respond to these changes, including the modification of city service delivery models where necessary. We will continue to provide the essential and critical services that our residents require without interruption, as we have throughout the COVID-19 pandemic. By order of provincial regulation, city-operated recreation amenities in parks such as tennis courts, soccer fields, basketball courts, fitness equipment, and each of the city-operated golf courses must close. The full list of amenities that have been closed by provincial order can be found on our website at toronto.ca. Beginning today, city staff have begun closing all affected outdoor recreation amenities. Given the volume of outdoor recreation amenities in Toronto, which are spread across the city's network of more than 1,500 parks, we estimate that it will take approximately 1 week to close all of the amenities ordered closed by the Province of Ontario and to post the required signage. All gated amenities will be closed and locked, and signage will be posted advising of the closure. The following city-operated outdoor recreation amenities were not included in the provincial order and will remain open: city parks and playgrounds, off-leash dog areas, outdoor allotment gardens and community gardens, park washrooms, and park benches. While city parks and public spaces offer the space to socially distance, they are a shared space, and everyone has a responsibility to act respectfully and follow provincial orders and city bylaws. Thank you for all that you're doing each day to help stop the spread of COVID-19 in Toronto. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on COVID-19 and immunizations in Toronto. Thank you.
Thank you, Chief. We'll go to questions now. Just a reminder to please unmute yourself. We'll go first to Mark McAllister from City News. Mark?
Thank you very much. We saw the province on Friday and over the weekend introduce the measures that Chief Pegg just referred to. Dr. de Villa, we haven't heard from you. I know Mayor Tory, you had spoken about what had taken place over the weekends. Let's start with Dr. de Villa then, if I get your reaction to the measures that have been put in place and the fact that some pivot needed to be made, and are the appropriate restrictions in place at this point in your opinion?
So thanks, Mark, for the question. You know, I can't really comment very much on what the province does or, you know, what they're thinking as they make their decisions. I am sure that it's a very challenging situation that they find themselves in. I will say a couple of things. One, I've talked about the extent of the threat that COVID-19 presents, and it's a significant one. And just given the extent of the threat, this is not a situation that can be solved locally. Clearly, this is a province-wide situation that calls for province-wide action. And I think I outlined in my remarks a number of things I think that must be true or that we must work to make true. One is to acquire more vaccines, as much as we can, absolutely. This is an important part of our strategy. Another piece, of course, relates to public health measures. And effectively, what we're talking about are measures that can be implemented and made to work in a fashion that supports the ability for people to stay apart as much as is possible. As challenging as that is, we know that we're talking about a disease that spreads from person to person. So the more we are able to keep people apart and to limit social interaction and interaction between people, such that you're really focused mostly on those with whom you live and only going out for the most essential of items, that's what's really important now in order to reduce transmission. I cannot emphasize that enough. So there are certainly things that governments can do. I talked about the kinds of things that can be done to enhance safety in essential workplaces. I've talked about paid sick days. These are just a couple of the examples of things that can be done to support that. But at the end of the day, each of us has a role to play as individuals around keeping our distance to the greatest extent possible, not interacting with others, really focusing on maintaining that distance so we can actually bring transmission down and let vaccines, as they become more plentiful, really do the work that they need to do. So, you know, at a high-level summary, that's what I would provide, Mark. I don't know whether the mayor has anything he wanted to add further to that.
Well, of course, I wholly support everything that Dr. de Villa has just said, and would just add one thing, which is that I think there is a real need for us, if we're going to work together, and I think that while it is definitely a province-wide problem that requires province-wide solutions, the need for us all to keep talking to each other, and that's local people and regional people and provincial people and even national people, is as strong as ever. And when I met the GTHA mayors and chairs today, we talked about the need for continuous, ongoing discussions between the province, the local governments, and the science advisors with respect to what public health measures would be in place from time to time. And that's just something where I think as this changes rapidly, so too do we have to make sure that whatever it is that's being done adapts itself to that and is the most effective suite of measures possible to wipe this virus out.
Thank you. Different question with regard to the community mobile clinics. Mayor, you spoke about the success of the one at Tobermory over the weekend. I'm just wondering at this point if both you and Dr. de Villa could speak to perhaps the fact that it was surprising that we've seen the lineups that we have again this morning at another location, and what that says about the worries before this point about hesitancy in those communities. And perhaps this brings up a different concern. Can we keep up with the demand in those areas?
Well, I will start simply by saying that is why quite a long time ago we began. Let me start that again. That is why quite some time ago we began a process of going to the grassroots with a program that we announced and ambassadors we sent into the community, utilizing the community health organizations, because we knew just from the initial response that in some of those neighborhoods it was going to take a different kind of effort to reach people who, for one reason or another, would be hard to reach. And sometimes when we see the success of clinics like we had this past weekend, we act as if it's the first one of its kind. And the fact is this was very successful. It was probably the biggest team effort we've seen, but in fact it is not an exaggeration to say there have been hundreds of these local clinics put on mainly by our hospital partners so far, as we have increased our efforts to include in a meaningful way with funding and with other kinds of support the community health organizations. We're having more and more success reaching people who previously had indicated some hesitation, or perhaps they just didn't have the same information that they needed to get access to the vaccines. And so I would just say it's happening exactly the way that those programs intended, whereas as we get the resources in place, get the community organizations behind them, turn them into an event, make it a citywide effort so we're all in there together getting people out to get vaccinated, yes, you have a lineup. That's a good thing. I mean, the lineup disperses eventually because people get vaccinated, and that's exactly what we're going to continue to do, as I said, over and over and over again for many weeks to come.
So I think the only thing I would add to that is that, it's absolutely correct. The mayor speaks of the partnership and collaboration amongst the many participants who made those clinics a success and made them a reality. But I can't emphasize enough how important that community leadership is. The mayor referenced that, having people in the community, trusted leaders within the community who are able to speak to, the safety of vaccine and to encourage local community members of the benefits of getting vaccinated is absolutely fundamental to the kind of success that was witnessed over the weekend. And I think it is really, really promising and very, very exciting from a public health perspective to see the interest that was displayed and hopefully will continue to be displayed on a go-forward basis. My sincere hope is that supply issues that have been experienced over the past many weeks, you've heard us talk about that, will start to resolve and that we'll be able to better meet the demand and the interest that has been generated thanks to the amazing leadership of community partners that are out there doing some very, very important work that we can't thank them enough for. So we'll look forward to working with our partners and continue to improve the service delivery and continue to improve the vaccination efforts as supply increases and as time goes on.
Thank you. We'll go next to Francine Copen from the Toronto Star. Francine? Just gotta unmute yourself, Francine. There you go.
Yeah, sorry, I had some trouble with the mute button. So my question is, Mayor Tory and Dr. de Villa, you've both spoken in the past about the fatigue that some people are feeling more than a year into this pandemic. And last week we saw the province enact measures only to walk them back, quite quickly. And I'm wondering, what impact does bouncing back and forth have on the public, which is already experiencing this, fatigue with the back and forth?
I'll start and just say this. I think people's confidence is maximized and is maintained when you're seen to do the right thing. And there are different ways you can end up getting to the right thing, and because we're all human beings. And in this case, I think we ended up in the right place vis-a-vis, say, the police issue or vis-a-vis the playground issue. And I think if you end up in the right place, then you will maintain public confidence and not make worse these feelings of fatigue and frustration that people feel. And I think that we've got other issues we've got to continue to work on to make sure that we can maintain public confidence. Public confidence is something that is difficult to maintain at the best of times. When you're in jobs like all of us are in, it is a very difficult challenge because you've got 3 million people out there you're serving that all have different views on how things should be done or when they should be done or who's doing them and this kind of thing. But I think it's important in order to maintain public confidence that you end up in the right place. And so to me, that is a chapter that we have been through. We've ended up in the right place on both of those issues, and we can now go forward and address some of the other continuing challenges we face, starting with getting people vaccinated and with having the right public health measures in place to protect their health and to protect the healthcare system.
Yeah, Francine, I think the only thing I would add is that it's interesting to me as I reflect back on the course of the whole pandemic, it kind of speaks to the challenges of trying to balance the interests of many and in a rapidly evolving environment. So I think the mayor is quite right that, it is good to see things change, right? Decisions made and change so that things end up in the right place. That's a very important, I think, component of decision making, and it's important to, change when the circumstances warrant that. But I think that what the situation speaks to is that very, very difficult balance of trying to meet the needs of many in a complex and constantly evolving environment. That's been the entire course of the pandemic, I would say.
My second question is for Dr. de Villa. You've mentioned a couple of times, you've mentioned the importance of province-wide action And I'm wondering what actions you think the province needs to undertake that haven't already been undertaken.
So Francine, we are having ongoing conversations with the province, and so I'm not going to get into great detail, around what the substance of those conversations are. I did allude to a number of the things that I think would make a difference. Talked about, workplaces and ensuring that there are provisions in place to support people to stay home when they're sick. I think that's an important component, certainly, and ensuring that workplaces are as safe as possible, that they're complying with all the necessary measures so that they don't become places where transmission is facilitated. We don't want them to become places where COVID-19 is readily transmitted, to the extent that we can limit spread as much as possible. Talked a lot about what kinds of measures can be put into place to help support people to keep distance and to wear masks as much as possible. But fundamentally, it does come down to each and every one of us doing the best we can to actually maintain that distance, to limit our interactions, with others, to really reduce our activities to that which is most essential, so that we can get beyond this stage, this very, very difficult stage of the pandemic. And of course, I would have to mention get vaccine as well as soon as your turn comes up. These are the things that I think each of us can do to help support whatever measures come into place, and to get us to the other side of this pandemic.
Thank you. We'll go next to David Ryder from the Toronto Star. Dave?
Hi, everybody. Thanks for taking the call. The first question is for Dr. de Villa, and I'm wondering, there has been some talk about the school openings for special ed students that are supposed to be happening, I believe, Wednesday for the Toronto District School Board. Can you tell me if there's been any change in plan that would change the ability to open just for the special ed students?
So Dave, at this point, I don't know of any change in plan. I'll have to connect with the team to see if there's anything further that I should be, made aware of. But as far as I know, all is continued, as planned.
Thank you. And the follow-up is following on Mark's question earlier, which is about the specific measures that were announced, the ones that weren't walked back. Dr. de Villa, you often talk about the balance between people's mental health, the ability to get out, do things that make them feel better in a terrible situation versus trying to stop infection risk. I'm just wondering if you can speak specifically to people playing tennis across from each other, or golfing on a course, or going out to a basketball hoop and shooting a few and going home. Is the risk posed by those activities greater? Does it overwhelm the positive benefits for people who are able to do that?
So, Dave, I think it's always interesting to try to answer these questions. There's never just a simple answer. I will say this. I'm 100% supportive of trying to get people the opportunities to be outside. We know that outside is safer, for sure. So it is lower risk, but it's not no risk. So we know that as people get close to each other, this is how COVID-19 spreads. And with certain activities, outdoor recreational activities, we know that there's a greater chance as people interact closely with each other as part of the recreation or sporting activity, whatever it might be. So certainly there are some activities that are lower risk, those that allow for the maintenance of distance while conducting that recreation or activity are certainly lower risk than those that are require more up close interaction between people. So at the end of the day, we're encouraging people to be in outdoor space, to get some sunshine and fresh air and physical activity for sure, but recognize that lower risk doesn't mean no risk. So there's still the importance of maintaining distance to the greatest extent possible, and certainly using a mask, a well-fitting mask, particularly at those moments where you cannot maintain that distance.
Okay, final question is to Mark Douglas from 680 News. Mark, go ahead, please.
Thank you for taking the question. To Dr. de Villa and Mayor Tory, if you could both comment on this one, please. If the vaccination rate continues as it is now, and we've just, you were celebrating the crossing of the threshold of 900,000 vaccines, how soon might Toronto cross that 1 million threshold of vaccinations into arms? And what would such a symbolic moment mean for the people of the city and especially for the healthcare workers who are trying to keep all the people of the city safe?
So why don't I start off? So Mark, when it comes to the vaccination rate, again, it's obviously dependent on supply, and we have been able to hit as the Toronto vaccination partners, again, depending on supply, anywhere between 20 and 30,000 a day. And I'll remind you that we're not working at full capacity yet. Certainly at the city clinics, we are not, full throttle simply because there isn't supply to allow for that to happen. So depending on what we see in the next couple of weeks, or in the next couple of days, I guess I should say, we should be able to hit that target soon. It's just a question now of, what kind of supply do we get? Because we do have lots more capacity. And certainly, I think each moment, each milestone should be celebrated. I think that's an important thing that we need to do. Certainly for our mental health and just our sense of community. I think it's important that we celebrate those accomplishments and achievements as part of the COVID-19 response. I think that's part and parcel of, getting us through this very, very challenging period of time that we've been living through together.
I can't add much to that except to say this. We have to start focusing on some of our positive achievements in this because, people do need a bit of hope. They are frustrated. They're down about this whole thing, and there are lots of reasons to be down. But our success so far with the supply issues we've had at actually getting done as many vaccines as we have put into arms is, I think, noteworthy. I like the Premier's target of 40% of the population of Ontario, including 40% of the population of Toronto, getting done by early May. And, if we get the supply, you just watch us go. We have put the capacity in place thanks to the efforts of Chief Pegg and a great team of people. We've got these great partners in the hospitals and community organizations. And so if we can just get the supply, whether it's through reallocation or through better luck on the deliveries, just watch us go. And a million will be, in the past because we'll have well surpassed that. We've gone through the 40% and got to where we need to get to with this as the most powerful weapon to defeat this virus alongside keeping our distance. And so I'm very optimistic about how well we're doing. And if we can just get a bit more good fortune on the supply, through whether it's good fortune because it's good luck or because it's by design, that's going to help us to achieve that target and more.
As a follow-up then, and just to follow up a bit more on this idea of the 1 millionth vaccine in Toronto and the 40% population target for early May, you've got a few weeks left to achieve that one. Now, given the success of the pop-up clinics that you had mentioned earlier today, and again, Dr. de Villa and Mayor Tory both, please, do you imagine a way to roll out more of these successful pop-up clinics in the hard-to-reach and hard-to-vaccinate areas as a way to sort of get closer to those goals of 40% and 1 million vaccines?
By saying we are doing the maximum amount the supply available to us permits us to do. There is not one idle person that is not going to be fully utilized to make sure that every single dose we have available to us is utilized either in a pop-up or a local setting, which we're now doing to an increasing extent, as we've indicated in the hotspots, or in the city-run clinics, which also accommodate people who are from the hotspots as well as a broader segment of the population. So as I've said, if we get the supply issue addressed, watch us go. We have the capacity to do more. And I'm not saying that in any way to be provocative. I'm just saying it's a fact that we put the capacity in place thanks to the leadership of a great team led by Chief Pegg. We've got the capacity in place, and now we just have to get the supply issue resolved. And it'll be a combination, as it has been intended to be from the beginning. We said way back when, before the first shot was put in an arm, it would be doctors' offices, in no particular order, doctors' offices, pharmacies, the city-run vaccination clinics, and other pop-up and mobile clinics. It was always to be a team effort and an effort with a variety of channels. And we're now relying increasingly on local people to get that done, and with some success we've seen in the past couple of weeks. So we're ready to go on all fronts. We just need that supply issue to get resolved.
Yeah, and I think the only thing further I would add is that it's just a matter of good professional practice to adjust in accordance with what you actually see on the ground. As the mayor rightfully points out, the plan had always envisioned that there would be a number of different channels used to provide vaccine to different segments of the population. So we have seen that there has been lots of benefit associated with mobile and pop-up clinics, particularly in certain neighborhoods of the city. I can imagine that that will work well in other neighborhoods as well, and we will continue to work with our partners to adjust our resources. And again, it is very much dependent on supply, but as supply becomes available, we will adjust our resources together as a consortium, if you will, of vaccination partners so that we're delivering the most efficient and most effective vaccine program that we can that is in concert with the supply that we have.
Could I just note one more thing, Brad and Mark? If you look at the list, and the reason I read it out today is because I think it is such a testament to the team approach to this, that you had people from the East Toronto Health Partners who've done such great work in the east part of the city, by definition. You had people from the Midwest Ontario Health Team. You had people from downtown hospitals, and you had people from local community organizations and Toronto Public Health, all working together, and I'm sure I've left somebody out, in this fantastically successful local clinic in one of the hotspots in the northwest end of the city. And that's a real team effort, and I'm so proud of that. I think we all are, because that's always what was intended, and that supplements the efforts of the city-run clinics and what the hospitals were already doing in this regard. And that's why I say we're going to repeat that over and over and over again, and it just says it's all for one and one for all, and that's how it has to be, and that's how it will be.
Thank you, Mayor Tory, and thank you for joining us. That concludes today's update. Our next scheduled briefing will be this Wednesday, April the 21st. Stay well, everybody.